I have a long history of mental health problems. My childhood was a bit rough. I was in foster care. I was born to addict alcoholic parents. I was raped when I was 17, and then I joined the military. And when I was in the military, I deployed as a medic to Iraq, and that added even more trauma onto it.
This is going to be so wild of a show. All right, folks, welcome to the One Moment Podcast. Me Familia. I've never opened it up with Me Familia. This is the first time. It tells you something, right? So listen, uh, we have an amazing young lady on our show again, and she was on our show sometime about almost a year ago, maybe around April or so. I forget right off the top of my head. And then I ended up staying with her and her husband in October when I was coming back from Seattle and had a freaking blast. And when I left her house, drove through the canyons of Utah. And I'm going to tell you, it's absolutely gorgeous and beautiful in that neck of the woods. Just so everyone knows that first time out there in the West Coast in the Midwest, I loved it. If I move, it will be to her area just because it's right outside the canyons and you can just walk out the back door or the front door or the side door, and you can see just the mountains, everything. It was gorgeous. So, anyways, before I get
It's beautiful
sidetracked,
out here.
uh,
It's beautiful here.
it is. And before I get sidetracked, okay, we're here to do a podcast and not talk about my Seattle trip, right? But let me do preface this. We talk about mental health, substance use, suicide, trauma, talk about anything related, women's issues, LGBTQ issues, anything goes, right? On the One Moment Podcast. So if you are triggered at all and you need immediate help, please seek it. Go to a local hospital or a local crisis center. You also have 911 and 988 and whatever other emergency services that you might have in your local area. So please utilize them. Now, I'm ready to get to the meat and potatoes of the whole deal because it's not about me. It's about Miss Marie, and not just about her, but also the goal of helping other people while we're here. That being said, Miss Marie, how are you doing?
Hey, I am doing good. I'm glad to be here today. It's been a while since I've seen you, and so it's nice to be here. And I'm honored that you asked me to come back on again. So I'm doing good today. How are you doing?
Ah, can't complain, living a dream. I'm telling you, I'm getting ready to pack up and go on another road trip. And listen, anytime you want to come on this show, it doesn't matter. You're more than welcome. Any time of the day or night, we'll make it work. So yeah. I'm probably going to be going to another road trip tomorrow, heading back to San Antonio. So,
Well, that'll be fun.
yep.
I, I don't have any big trips planned soon. I had a nice fun trip. You know, November and December. I went inpatient for myself, so that was fun.
All right. So, the inpatient. Now that's interesting because I work on the inpatient unit. Now I can't tell people where I work at, not on a recording, but off script I can. And so it's interesting on what we do on the inpatient unit. A lot of people think that an inpatient unit is supposed to be 30, 45, 6 months, 90 days, whatever, 2 years on our units. And it's like, yeah. So tell us about where were you at and, like what was taking you, what was going on for you to go to an inpatient unit?
So, if you're okay, I'd like to just backtrack and just kind of tell a little bit about my story in case anybody hasn't ever met me or anything,
Sure.
and then
Go
I'll
ahead.
jump into this.
Absolutely.
Um, I have a long history of mental health problems. My childhood was a bit rough. I was in foster care. I was born to addict alcoholic parents. Foster care dealt with different types of things. I was raped when I was 17, and then I joined the military. And when I was in the military, I deployed as a medic to Iraq, and that added even more trauma onto it. And I never really dealt with much of my trauma. at all. I kind of, was very selectively honest. I would talk about this so people wouldn't ask me about this. And so I never really got into dealing with my mental health stuff for years and years and years. And I ran to addictions, people, places, drugs, alcohol, medications, food. And it was all about what I could do to make myself feel better because I didn't have an adequate solution to feel better. And I didn't know that I needed a voice. I had filtered myself for so long and became a chameleon, to just kind of blend in and just push my emotions down, or I became a peacock to stand out and be obnoxious, and that's how I got my needs met, or physical intimacy was how I got my needs met. So there was a lot of not knowing who I was. And I got sober actually while I was inpatient, in January 17th. On January 17th, I hit my 9 years of sobriety, and so that was, pretty incredible. So, when I got sober, I started working through many different layers, um, and as I was working through layers, other layers came up and more layers, and then I also started having once I got rid of the physical comforts, the drugs, the alcohol, I sought food. And in food, I got up to 250 pounds, started losing weight, found out that I had a genetic condition that caused a lot of damage to my joints, um, called hypermobile Ehlers-Danlos syndrome. And with that, it's something that apparently I've had since childhood, but over the years, different things have triggered it. Different things have made it worse. The physical toll of the military and the toxic exposure in the military, also my own toxic exposure with the drugs and alcohol, and then gaining the weight and stuff like that. I had to get both of my hips replaced, and I got caught up in bulimia again for a while. And so the first time I really started addressing my mental health was at almost about a year and a half sober, and that was when I went to the psych unit the first time. I was diagnosed borderline with PTSD and bipolar. I did trauma therapy, cognitive processing therapy in 2022. And as I started processing through my trauma, the meds stopped working and they were like, hey, you are not bipolar. You are strictly borderline. And the meds that we have you on are not going to work. And we need to continue working through the trauma aspect. So I got off of all of the mental health meds. The next year is when I got my hips replaced, got stuck in the bulimia. 2024, I did an intensive outpatient program right after I got out of the care facility for the hip replacements. And last year, the beginning of the year, I had decided that I wanted to start getting my story out there. I was doing much better. I processed through a whole lot of stuff. I decided to publish a book, which is a book of poetry about recovery from trauma and addictions. And when I published that, I decided that I wanted to get my story out there even more. And so I started podcasting. And so I went as a guest on a podcast called Every Day's a Saturday, USMC veteran. And I shared my story, and he invited me to come back as a co-host. And so then I started podcasting more with him, but then also, I was introduced to you and a few other podcasts to kind of get on there and share my story. And I really started getting involved with veteran advocacy and recovery advocacy for trauma and addictions. And as I was doing all of that stuff, I was also moving forward in a new marriage. I got married while I was in the facility getting my hips replaced. And we went on our honeymoon last year. And there was just many different layers. So I was finally feeling like I was living life, and that a lot of the chains had fallen off. And then, my dad passed away in July. And when my dad passed away, that kind of started shaking up a few things in my mentality. Um, and then also with my hypermobile Ehlers-Danlos syndrome, some of my physical stuff started getting worse. And I had found out that I had a uterine prolapse, and I am in the process of getting scheduled for a hysterectomy. I also found out that I needed to get another surgery for a hiatal hernia. Also found out that there's a lot of damage in my wrist and some of my other joints. So even though I was feeling like I was doing better than I had in a very long time, my book is titled More Me Than I Used to Be, A Journey to Freedom, because I genuinely have been feeling like I'm more me. Like I was holding on to a lot of pain and anger and frustration and resentments and kind of lost who I was for a long time. And last year I've really started feeling like myself and started having more traumas. And around this time, as well as I'm trying to just process through a whole lot of things, there is some stuff from my childhood that started rearing its ugly head. And my even though most of the time I was doing really good, my borderline was under control for the most part. I would catch myself, and if anybody doesn't know about borderline, I encourage you. There's a book that I just was introduced to. It's called I Hate You, Don't Leave Me, and it is a phenomenal book. That is like I wish I had it 8 years ago when I was diagnosed. That book is just phenomenal, but it's basically just a really good text about borderline. And what I have learned is that borderline is actually it's called borderline because it's on the edge of mostly every other mental health. Like there's a picture in the book where borderline's in the middle and you've got schizophrenia here, you've got bipolar, you've got ADHD, you've got kleptomania, you've got psychopathy, you've got all of these anxiety, depression, what is it? The food disorders and like anxiety. Anyways, you've got a little bit of everything there, and borderline kind of touches it. And sometimes it mimics all of these. Sometimes people get diagnosed with all of these, even though it's borderline, and vice versa. Some people get diagnosed borderline when they're actually something else. So there's a lot of overlap that happens. But with that, it's basically I have a very, very quick trigger to a lot of deep, heavy emotional responses. And with that, there is something that's called dissociation that happens. And so dissociation is there's disassociation and dissociation. So disassociation, this is what I have gotten really good at in my life. For many years, I disassociated from an uncomfortable situation with my drugs, with my alcohol, with my addictions, with my food, with people. I disassociated. I pulled myself out of the situation and I went into distraction. In my sobriety, I have learned how to disassociate in healthy ways. I pull myself out of an emotional situation. I go right. I call my sponsor. I go out to a meeting. I go talk to a church leader. I go and do a puzzle. I do some reading. I go for a walk. Whatever it is, I disassociate from the situation or the emotional turmoil that's happened. And I'm like, okay, I'm going to move over here. This situation needs to calm down. I'm going to go do something for a little bit and then I can come back to it. Now, there's that. And then there's something called dissociation. This situation, this emotion is so heavy and I am keeping myself in it, but my brain doesn't know how to handle it. So my brain goes bye bye. And so that is where the fawning comes in, the fawning or the freezing, where you're just kind of stuck. The other one is like flight. You've got an unhealthy flight disassociating, and then you've got healthy flight disassociating. But what I was doing was like fawning and freezing. and I would be in this situation and my brain would kind of go bye-bye. So what was actually happening is while I was inpatient, I learned that I was dealing with some emotional turmoil. And instead of actually addressing what was going on, my brain would kind of go away and I would turn into a very hyper emotional, irrational kind of teenage mentality seeking validation and approval. And what was happening is I was taking that out on my husband and I was seeking him to make me feel better and when he didn't I would get mad and get frustrated or he would try to be like, I need to leave this situation. And in my brain I'd be like, okay, good. This situation needs to de-escalate, but I would physically follow him. I would watch myself following him trying to get validation from him, trying to get him to fix me. And so what would happen is I would have these emotional responses just from my own traumas and triggers. And then instead of addressing them and like feeling them and allowing myself to have the processing capabilities, and instead of running away, I would just yeah. So it kind of just turned into this codependent, trauma cycle, and I wasn't being very fair to him or to other people that were in my life. And I knew that it wasn't okay. And so I ended up after a couple of weeks after I finally realized what was going on and realizing how unhealthy it was, I actually like moved out of the house for a little bit because I knew I wasn't okay and it wasn't being fair to my husband and I I did it in the wrong way. I didn't talk to him about it and I just left. And that was not very nice. That was not a very good way to do it. Um but in my brain where I was at because I wasn't actually properly feeling the emotions, I was like, I don't know what to do. And so I pulled out of the situation and I had talked to a therapist and the therapist was just like, "Hey, like you need some extra help. You have a lot of stuff going on." And I didn't even realize how bad it was. And so I originally was going to go inpatient to work on getting TMS, which is transcranial magnetic stimulation. And so it's not the same as electroshock. It's magnetic and I'm not sure everything to do with it, but that was my plan, was that I was gonna go inpatient to do that. But while I was evaluating doing that, I realized I just needed extra help. So I ended up going into the crisis center in the middle of December, or yeah, the middle of December, and I went in there and I was like, I need some extra help." And after 2 days of being in the crisis, they tried to send me home. And they're like, "Okay, we're getting you ready for discharge." And I look at them, I was like, "What are you talking about?" And they're like, "Oh, well, you already have like all of this knowledge, you're very well educated. You already have all these tools." And I'm like, "I am not okay." Like most of the time I am okay, but there are these moments that I'm feeling these emotions come up and I don't know how to handle them and I'm dissociating. And I am not okay with that because in my dissociation, my fear is that going to go back into my addictions or I'm going to hurt myself because I'm not allowing myself to feel the emotions and I don't like the emotions. And so that was my fear, that I was going to in a dissociative episode do something to hurt myself or go back to my addictions. And I did not want to do that. So when they're like, "Oh, there's a safety concern?" And I was like, "People, like I'm in a crisis unit. Of course there is a safety concern. I wouldn't have come inpatient if there wasn't a safety concern." So they're like, "Oh, that changes things." So then they sent me to the actual inpatient unit. And while I was in the inpatient unit, it was really good. It was really a reset. I was in just a general inpatient for about 2 weeks. And doing that was really just a great reset. I did some individual therapies, I did some group therapies. I got into just like group connections and stuff and actually allowing myself to label the emotions that I had coming up and utilizing some different tools. Although they were tools that I've already had, they were helping me to process through the tools more often. While I was in there, between me and the doctors, we decided to look into an actual intensive PTSD program. And so I was able to get into this program. It's called Strong Hope, and it's here in Utah. And it is mostly for active duty military and also for veterans. And so it was a very intense program that was um, for complex PTSD. And so in that from day 1, like day 1, they're like, "Hey, guess what? We're gonna have you do an in-depth timeline of every single trauma in your entire life. Oh, and every single maladaptive behavior you've ever participated in." So that thing was intense. It was intense. And I didn't even realize how much trauma I had in my life. And I didn't realize how much was still holding on. And I learned about something which you've probably heard about, something called schema, which is the early maladaptive beliefs and behaviors.
Right, right. Yeah, you're taking me back to grad school and undergrad. I'm like, man, I ain't heard that term since grad. I mean, since I left college.
Yeah. Yeah, and I'd never heard of that term before. I never have. Because and I also learned about something called moral injury. And I've never heard of that before either because, apparently there's like different layers of PTSD. Because like I've always known that I've had PTSD. I've feared for safety, before. But there's this other layer called moral injury. So one is a fear of your safety, and then one is you know, if you have seen or experienced or learned or witnessed or participated, I think seen, heard, witnessed, participated, and there's a fifth one. I can't remember. But if there's anything that you have learned you have learned of or participated in that goes against your moral values, that causes a form of PTSD called moral injury. And so this is stuff that shapes your beliefs and stuff. You've got the PTSD where like, "Oh, I'm scared for my life and I'm jumpy and I'm like, oh, I can't trust these people." But this is even more in depth that goes into your beliefs about people, your beliefs about yourself and stuff like that. And so it was like the coolest thing learning like this program. I wish it was available for everybody. And if you are a veteran or active duty member that is learning about this, you need to ask your unit or ask the VA about Strong Hope in Utah through Salt Lake Behavioral Health. And I am going to shout that on the rooftops because it was one of the most fantastic programs, you know, and I wish that it was available for civilians too. And I hope that there are programs like that available for everyone because it just was phenomenal. Like they had just a whole team of people that helped me evaluate what my schemas were, what my moral injuries were, and how I was participating in perpetuating some of those things with my own actions. And they also really, 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 really focused on feeling your emotions in the moment. And like they like I mean it's you think that to allow yourself to feel the emotions, right? But I was not. Like and I've been doing this for 9 years, with mental health stuff and with my recovery and stuff like that, but I still wasn't allowing myself to actually feel my emotions in the minute in the moment. Because what I was doing was I was feeling the emotions and then I would reel into trauma. And I didn't want to do that. So then I was avoiding. But apparently, and maybe you can touch base on this a little bit more because I'm sure you probably know more about this. But from what they were telling me and what they were explaining, which was just this mind boggling thing, is like the actual emotions only last like 90 to 120 seconds if you actually allow yourself to feel them without reeling into the trauma. Have you heard something like that before?
So I've heard similar stuff, and I actually teach that not on that idea of allowing yourself to 90 seconds or whatever. Um, I teach the difference between an emotional and cognitive reaction, and I also teach the importance of allowing ourselves to feel our emotions because so often, people think that, and I do this all the time. Every time, anytime we get on this topic in a group therapy session, I'll always ask, be like, how many of y'all think that anger's a bad emotion? Half the group will be like, I do, I do. I'm like, huh, all the time, right? Uh, and so the goal of recovery is allowing ourselves to feel every emotion that we have. Unless we, if we don't allow ourselves to feel that emotion, we're going to continue to push it down and continue to run from it. That's why we have people that struggle with addiction because they start getting anxiety, they start getting uncomfortable, they start getting this dis-ease, right? And every time I drink liquor, I do dope and all of this, or engage in some type of pleasurable self-soothing activity or self-seeking activity, unhealthy manner here. Could be sex addiction, could be whatever. In that moment, I'm escaping that feeling. I'm escaping the way I feel. And so recovery is about being comfortable with not being uncomfortable. So I teach everything that you're asking about. And yes, a moral injury is absolutely true. Research supports that idea that PTSD veterans struggle with more so than not struggle with moral injuries. And then you'll have people, depending on what type of trauma they have, those who are not veterans will also struggle with a moral injury. There was actual case study. One of my professors actually did it, and I'm not going to, name any names as far as where the college I went to or anything of that sort. But a moral injury for anybody who doesn't understand, and then I'll tell you the case study too, is actually a real life, situation that happened. But a moral injury is, let's say you take a veteran and they are, you know, in active war, and let's say they do something to harm a child in a active war, right? A moral injury or a struggle with the moral injury is the fact that they had to do something to protect themselves from that child, and they think that, man, I should have never done that. I shouldn't have done that. I shouldn't have done that, and they have this constant feeling and this constant thought. That could be something a moral injury could come from. Another situation that a moral injury can come from. If we go back to that case study, actually happened. I think it was in the state of Virginia. Uh, a father took his little 12, 13-year-old child, and as he was raping and molesting her, he was quoting Bible scriptures to her, and he was a preacher, right? And I mean,
It's
every time
horrid.
it was all the time that he would do something, he was always quoting scripture, and so um, she ended up getting pregnant as a teenager, and he forced her to sacrifice the baby, where allow him to sacrifice the child. And this has been in the last 30 years. Okay, last 30 years, this stuff still happens for anybody who is listening. um and as he was sacrificing the child, of course he was quoting scripture during this, right? And it's like, and she struggled spiritually, she struggled morally, like she struggled with that, and I mean, for a long time.
And
So
that's
that's
her
another.
own that's her own moral injury and his. Like, she's
Yep.
watching him go against morals, and then she's participating,
Yep.
and so that's 2 different layers, yeah.
Yeah. I mean, that's very, and so, yeah, so a moral injury can encompass more than just, an act of war. Can be anything that is a moral injury. And that is a huge struggle for a lot of people.
Yeah. Yeah, and I didn't realize that I was holding on to so much moral injury from my past, from my childhood, from people I love, but also from my own actions. And, a part of that as well is, so one of the things that I realized while I was in a facility is that I am struggling, like a moral injury for myself. And, this is not against or for or anything like that, but for myself, I am planning a hysterectomy and I've never had children. And growing up, and I'm probably going to get emotional, growing up, I wanted to be a mom. And I was raised that having children was this great, wonderful, fantastic thing, right? And, as when I was out in my addictions, I'm grateful that I didn't have any kids out of wedlock because I was not in a good place. I was, with the drugs and the alcohol and just the lifestyle I was living. And when I got sober, as I've processed through a lot of stuff, I made a conscious decision that I wasn't going to have children, and especially after all of my genetic things that I'm finding out, I have made the decision to not have children, and so when I started planning the hysterectomy, like I've already had made this decision. My husband and I have had that conversation, like we're okay, and already had made the decision. But when I started planning the hysterectomy, that moral injury really hit me. Who am I as a woman without the ability to have kids? Who am I, in my religion or in my family or in society or whatnot. And even though it's not it doesn't have to be a moral injury, but for me it is, because it's something that goes against the morals of me growing up, you know? And so it was just, you know, yeah. So that's just another layer that was coming up, if that makes sense. So, but, as I was processing through stuff, um, I was able to kind of get to a better place with it, and I am moving forward with the hysterectomy now, and so we'll see what happens, but I know that it's just gonna be more layers that I have to process through.
Yeah. No, and it does, and it is, and even after that, I'm fixing to go through, Thursday, I'm fixing to for those of you who don't know, and, of course, this is live, and so anybody can watch it, and, I mean, it's one of those things even Imma have to struggle with a moral injury too. I'm about to go, and I say a moral injury, it'll be a healthy moral injury because I do think that things are positive and negative, right? I think there's two aspects of things, just like you can be selfish and self-centered, but is it healthy versus or is it unhealthy? You see what I'm saying? So I'm about to go through on Thursday with a kidney donation, I'm about to donate a kidney to somebody who needs it. And so only thing that's going to stop me is only way it will not go through is if the hospital says no between now and then. As far as that's concerned, I'm moving forward with the kidney donation. Um, and I'm looking forward to it. And so when you say that there's a moral injury, it's not just a it's not just a negative moral injury, right? There's a positive moral injury too. What I mean by that is because you struggle with the emotion of doing things, right? But a moral injury could also be positive, and the reason that is positive is because you struggle with the idea of, "Wow, I just did something for somebody. Wow, I hope everything goes through. Wow, I hope I don't have a disease that was not found and was transferred over." You see what I'm saying? Like, you have all these what ifs, like, and so I'm even struggling with a lot of those things now. And so moral injuries I mean, just encompass many things and many aspects. Um, and so it's one of those things like, how do we deal with it? How do we cope with it? Well, I think how we cope with moral injuries is, I don't think it's living in the moment as far as like living in the what ifs, living in that space, right? I think it's really just taking a step back and just looking at it non-judgmentally and saying, "Hey, I did the best I could, right? I did the best I could with this. I did the best I could with that. I'm doing absolutely everything in my power to, you know, do what I feel like I'm being led to do, or whatever the situation might or might not be." Um, I think it's allowing ourselves to, because you spoke a lot about also these things, these schemas and stuff, right? And so I think a good part of recovery and healing is allowing ourselves to just have the basic uh human experience is really what it is. We're going to get mad, angry. We're going to have successes and failures. We're going to do things greatly. We're going to do things inappropriately. We're going to do things right. We're going to do, I mean, there's so many things, right? We're going to not always say the right things to people. We're not always going to say the wrong things to people. We're going to make mistakes in relationships. We're going to do great things in relationships. I'm one of those that like to build big, beautiful relationships. People just like that freaking stupid politics bill that was passed, big, beautiful bill. Well, I like to take politics out of it and just keep it back on me and say big, beautiful relationships. That doesn't mean I'm going to do perfect or be perfect. It just means, hey, I'm going to be learning a whole lot of stuff along the journey. So, that's part of what I think is the essence of getting, or not getting over, but getting through and healing in recovery. Does that make sense?
Yeah. Well, what I was thinking as you're talking is like as I was processing through and learning what my deep-seated schemas actually were, I was learning that I was taking some of the moral injury that was done against me, and I was seeking for my husband to make me feel better about that, if that makes sense. And I was realizing that some of those traumas that when something would trigger me, even if it, wasn't a big thing, or something like that. But if he didn't, if he didn't do something the way that I think that it should have been done, right? Then my brain went into that moral injury of people hurting me in my past, and it's like, "Oh, if you obviously hate me and you wanna hurt me and you want to leave me, or you're gonna try to find a reason for me to." Anyways, like, my brain would just go into these obsessive spirals where I would just lose my emotions, and I was going in, like, the obsessive spirals into those schemas, and the schemas are like the stuck points, and if you've ever done cognitive processing therapy, or cognitive behavioral therapy, or whatever, if you're doing that kind of stuff, you learn about those stuck points, but a stuck point is like, "Oh, he said this, that means my husband hates me." That is an example of a stuck point. But the schemas were, kind of like, if somebody doesn't fulfill this, then it means that they're gonna leave me because everybody else that's ever been in my life has always left me or hurt me. And those were like these deep-seated beliefs that I had of abandonment, that people ultimately hate me, they don't like me, they want to leave me, they're looking for a reason. If I don't behave a certain way, then 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 I can't fit in, and if I can't fit in, then I'm doomed and I'm gonna die. And so it's just these huge, huge things that I was getting stuck in, and it just wasn't healthy. And so I'm grateful that I was able to go into that program and for them to start pinpointing. It was only a beginning, you know, but 8 years ago or 9 years ago when I got sober, 8 years ago when I started on the mental health journey, I wouldn't have been able to hear all of this stuff. There's no way. There is no way. I didn't want I was still blaming everybody else for everything. And the whole thing with this program, it's basically like taking out everything that other people have done to you. What are the beliefs that you're still holding on to? and how are you perpetuating your own traumas by living in those beliefs. And so it was so beautiful to be able to do that and then just kind of learn more about borderline and how borderline personality was something that my brain developed to keep me safe, you know, and learning more about what that was. And you had mentioned earlier about anger. When I first read through my trauma timeline, my therapist in there, he's like, "You have a lot of anger." And I was like, "No, I don't. I don't get angry. Like I've never been an angry person, like I internalize everything. I don't take it out on other people. I'm not angry at other people. I get a little frustrated." And he's like, "Marie, you have anger." I was like, "No, no, I don't." And I even talked to my husband about it and he's like, "You have anger." And it comes out more than you realize. And I was like, I have anger, but for me, like you said, anger was so negative and it was such a bad thing to feel. Like anger turns into violence. Like I'm not allowed to be angry. And when I was younger, when I would get angry at people for picking on me or doing stuff that went against my values, right? I would get told that I'm just too sensitive and I need to get over it. And so I never allowed myself to get angry. And in this PTSD program, they gave me this tool and it's something that I tried doing years ago, but I never really got into it. But in the facility, I did. And it is taking a pillow and beating your bed with a pillow. And so there was a couple situations that came up and I just had all of this stuff and I didn't know what to do with it and I didn't want to run away and I didn't want to hide and I didn't want to dissociate or disassociate. So I was like, okay, I need to feel this anger, but I don't know how to feel anger. And so I just went and beat my bed to let the energy out because that's what I've realized, that anger was just this pent up energy that I was holding on to with regards to feeling unsafe or feeling resentful, And so I was like, okay, let me get this big energy out and then allow myself to realize like, yeah, I'm pissed. Like I'm allowed to be angry. Like this is a really shitty situation. It's okay for me to be angry. And so that was like this whole mind blowing thing where it's like, oh, anger's okay. And if I do have all this pent up energy, it doesn't have to turn towards violence or resentment towards myself or towards other people. I can just let out the energy. And yeah. And it's the same thing with the just the over emotional feeling fear or sadness, just allowing myself to actually cry because that's the thing is like I would start crying before I went into this program. I would start crying, but then it's like, okay, I can't let go of control. Like how do I control this? And so then I would go disassociate or dissociate, because just the act of crying made me feel like I was out of control. And so I really started just learning how to sit in the emotions and allow myself to be angry, allow myself to be sad. Also, allow myself the positive emotions too of feeling genuine joy. And we really did a lot of work on mindfulness. We did yoga. We did 3 days a week of yoga, 4 days a week of CrossFit, working out, and a lot of, like, music therapy and art therapy and stuff like that, and just learning how to be present in the moment and identify the emotions without reeling out of control, and anyways, it was just such a phenomenal, phenomenal thing, and I've been out for a couple of weeks now, and, life is still lifing, you know, but I am back at home and, kind of taking things easy and working on allowing my emotions to come through. I told my husband, I was like, "Listen, I'm gonna be extra emotional," and I was like, "It's not that I don't need any fixing, there's not much that I can do about it right now. I just have to allow myself to feel the emotions." And then I started a comprehensive DBT program, which I guess is the kind of the gold standard for borderline personality. I've already taken the class twice before, but this one is different because we are actually meeting 3 days a week. And well, we did 2 days this week, and then next week we're starting 3 days. But it's individual dialectic behavioral therapy skills with my therapist. And then it is 1 day of trauma therapy with my therapist, and then 1 day of a group DBT therapy. And so with that, she's also doing on the phone coaching. So it's kind of like it's not like an IOP, which is in um, intensive outpatient, where a lot of that is more so for like the acute stuff. But this is more like training wheels for the chronic stuff. And so it's like, hey, we're going to treat you like you're inpatient kind of. You're going to have all of this stuff, but you're at home. And so as things come up and as you're processing through stuff, we're going to help you utilize your tools on a regular basis. And so with that, I'm excited to get started on the group therapy next week. Um, but yeah, so things are definitely, I feel a lot better having more of the skills and the knowledge and also more of the support. Because before I had therapy, but it was, once a month, it just wasn't enough for where I'm at, and so I think that this is going to be super beneficial.
Well, and I think that, when it comes to chronic and or acute, I think for me, I do therapy once a month, right? And I've been doing that since I think right before COVID is when I started, or right around the time COVID is, had come into the picture. I continue to see the same therapist, and she's freaking phenomenal. Love her, and she's amazing. Um, but you have those that, you know, uh, I heard a nurse practitioner or a physician's assistant say this one time: medication assisted treatment. And that A is the most important piece because it's assisted treatment, right? And I say that to say this: my experience is my experience, and many people need a higher level of care. And that higher level of care could be a state hospital, could be a crisis inpatient unit at a local hospital, it could be a residential treatment program, it could be um, PHP, IOP, it could be what you were just describing, with the virtual and not BPD and stuff like that. Um, and I think that's, to each her or his own. And I think that, you know, that individual, needs to be able to sit down and be and do as you did, right? And be honest with their provider because, when you are talking to people, and this has been my experience, right? If you don't tell me what's going on, I can't help. Like, it doesn't matter. There's nothing I can do. I can't do anything. Um, I can't give you any referrals because you're telling me everything is fine, quick, dandy, hunky dory glory, right? But if you do tell me, I can give you referrals, I can help you out. And I think that's a huge problem, in the healthcare field. I mean, that's a huge gap. Another gap that I do see too, and this is a issue that I try to focus on when I'm doing my clinical practice, is that um, over 75% of Americans report not feeling like they are important. Right? They feel like they are a number, and I think that it is important for us to look at that because when you have most of the country saying the same thing, Now, that's not just me as a therapist saying, okay? I say it and I scream it to the top of my lungs. I have many other healthcare providers disagreeing with me. And I'm like, do y'all not see what y'all are doing? Y'all are treating people like they're freaking a number and a dollar. Like, if you work for me, I'd fire your ass right now, you know? And I see that all the time. And, but anyways, to each her or his own. And it's not just on the patient side either. We also have healthcare providers, like I say, most of the ones that I have worked with, most of not, I ain't saying about where I currently work at, but previous places of employment, I fire you. I fire the shit out of them. They're useless as healthcare professionals. They treat their patients as they're a freaking dollar. Like, I've worked with few people who actually believe in quality care, quality over efficiency. And I've worked with even much fewer people who actually implement a healthy balance of quality care and effective treatment or efficiency in their program. And that's okay, right? You always, and right now, and I think this is why we have 75% of Americans plus report that our healthcare system is completely, absolutely broken. And if our healthcare system is broken, well, mental health, substance use, and suicide is the second cousin to it, right? So if this is broken, this is shattered completely. And so when over 75% of Americans report this shit, don't you think people would listen, right? And then this also, if you're thinking about, right, if you think about, and I say this all the time and people call me crazy for saying it, but I'm gonna say it again. I'm gonna shout it till the day I die. Uh, are you ready for this part? Because this is part that I didn't hear you say, which this is why I love the place you went. Well, currently in most of our facilities, most of our programs, regardless if it's residential, inpatient, outpatient, at least a fucking chart ain't going to fucking relapse. Okay? Like I say, efficiency over quality, we lose quality care, we lose patients, and we get nothing but absolute straight treating patients as their numbers and a dollar. So at least a fucking chart won't relapse. That's my end of rant. That's in the end of my rant. But but reality is, and that's why I support that program that you went to, because I think that you know I think when we start treating people as they are people, as you have said, you were getting ready to discharge, and then you said, "Whoa, whoa, whoa!" I'm thinking about, like, if this happens, like, it's going to be a heck of a mess, right? And when they heard you say that, they listened immediately. And we don't have that. We don't have that in the healthcare field. It's not widespread like it was with you. So I appreciate you sharing that.
So there is a big thing to take in consideration with that. Yes, there is definitely some inconsistencies in the medical field. And there's definitely people being treated as a number. That is a huge thing. And people are not being taught how to advocate for themselves. That's the thing. I am a stubborn little a-hole when it comes to advocating for myself, because if I don't advocate for myself, no one else will. And that's the way that I look at it. Is yes, there are people who will, but in my mind tell myself, if I don't feel like I'm important enough to get help, nobody else is going to. And so I have to be loud. I have to advocate for myself so that people know that I need the help. And this is why I am such a huge advocate of healing out loud. And that is why that is the platform that I stand on, is healing out loud. Is I am loud about what I have going on, to encourage other people to say, "Hey, you have to use your voice too." That's one of the things that I do with recovery advocacy, inside the veteran community and just recovery in itself, from traumas and addictions, is I'm like, I share my story to let people know, like, you have to be loud about your own traumas, your own struggles, your own stuff. Like you have to be your own advocate. You have to reach out for help because there are so many different programs available and there are so many awesome therapists out there, but you have to be an advocate. If the therapist you are working with is not helping you, then you get another therapist. If the doctors are not listening to you, then you get a different doctor. If you feel like you're being treated unfairly, then you get an advocate involved, like a legal advocate, disability advocate, or a patient advocate, whoever it is, you know, like you have to learn how to be your own advocate, to reach out for help and to let people know that your story your story matters, right? With regards to your mental health, with regards to your physical health, with regards to your recovery, with all of this stuff. Like your voice matters. You have to find your own voice, whatever that looks like, you know? And so yes, the medical field has to make changes. And I am so super blessed. I am so grateful that God saw fit to lead me into the military and that I was able to get, even though it hurt for a long time that I got a medical discharge out of the military. I am so grateful that I did. I'm so grateful. And I'm so grateful that I have the disability through the VA because my medical care through the VA, I have a lot more options than other people. It sickens me to hear some of the stuff that civilians have to go through with regards to medical care and insurance and coverage and this, that, and the other. It sucks. There is a long way that the medical field needs to go, a long way that insurance needs to go. But, and, no but, and you have to be your own advocate. Like I'm been talking to somebody who there's like a whole county of medical that is not working for her. She's having issues. And I'm like, okay, if that's not going to work for you, get a legal advocate and get your stuff switched to a different county. You have options. There are actual law firms that fight for this kind of stuff. There are lawyers that will help you get better treatment. So fight for it. Fight for yourself because if you are not putting energy into yourself, then how can other people put energy? And there's a lot of people who get stuck in victim mentality where they're like, well, this is just how everyone's going to treat me. This is just, and no, it's not. I promise you, there are people like Kevin right here is a perfect example of somebody in the mental health facility who cares about what you're going through. There are a lot of people that are out there. There are a lot of programs that are out there, so please, if you're listening and you are struggling with whatever care that you're receiving right now, be your own advocate. Fight for your own help. Go and make sure that the doctors are listening to you. And if they're not, go get one of the legal advocates because they are there to help you. So you have an option. A victim by nature is somebody who doesn't have options. You have options. You are not a victim. You may have been victimized in your past or victimized by the system, but you don't have to be stuck in victim mentality. There is so many resources out there. And then you've got the legal advocates, you've got the patient advocates, you've got the medical advocates, and then there's also so many nonprofits out there that are willing to help you fight as well and willing to help you get better treatment and stuff like that. So please do not get stuck in victim mentality. There are two sides of the road here, and there are a lot of people in the medical field who are fighting for better treatment options. And you also have to fight for yourself. So, sorry, that is a huge thing that I had to get out because I just see people that just get stuck in the medical field is so wrong. So what? Yeah, it sucks. Go make a difference for yourself. You can't fix the
Okay.
whole world, but you can move forward and get the help that you need.
Absolutely. No, 100%. And while you are advocating for yourself, just let me propose this idea or this theory. If anybody has contacts with Propel, the people who make Propel, okay, tell them I'm looking for a sponsor for the show. Uh, right, just saying, I'm just throw this idea out there. In every show, I'm always drinking one of these, so I think I deserve to have Propel sponsor us. I'm advocating for myself here.
There you go. There you go.
Right. Oh my god.
Hey, can I share, a poem that I wrote while I was in the facility? Just, I wanted to do it earlier and completely forgot, but it's called Facing Emotions. Can I share that with you?
Oh, go ahead, please. I want to hear it.
Okay. So, in moving forward in my life, I've got a couple different projects that I'm working on, and I'm working on getting ready to publish another book of poetry, and this is one of the poems that I will be putting in there. But as we were talking about, like even with regards to like this advocacy stuff that we're talking about, right? Like there are so many emotions that come up when it comes to seeking medical care. And we have to allow ourselves to feel those emotions and realize that it's okay to be angry, it's okay to be sad, it's okay to be frustrated, and we can keep moving forward. And that's part of getting out of victim mentality is allowing ourselves to feel the emotions and keep moving forward so that we're not stuck in that victim mentality. Um, but while I was in the facility, I wrote this poem and it's called Facing Emotions. I'm in a place I've never been. It seems unfamiliar. I'm facing emotions without distractions, which really feels peculiar. Where once I ran to addictions anytime I felt pain, now I run to God for help, healing to attain. I've gone through many layers of this, though never quite so raw. There are insecurities I never truly saw, wounds that were so deep, even food would be enough to distract from the pain that felt so very rough. Yet, food has lost appeal, no more safety found in it. Emotions now on the surface, in fear, I choose to sit. I'm facing things from my past, taking away their power, giving them to God so they don't taste so sour. I'm getting help again from doctors who will give me tools to help me fight the pain through 1,000 little tools. This time, I refuse to tie an arm around my back. No addictions left to disarm me on my track. I'm looking at those fears that used to paralyze me and taking many micro steps towards the day I'm free. I don't know how much longer I must dig through deeper layers. I'm grateful I am finding there are many different players. I keep finding on this journey that I am not alone. Others keep reminding me God's love is always shown. I know as I continue, full healing will be found. Fear will stop shouting, and love inside me will abound. For now, I'll keep prying open the wounds in my heart so they can heal from inside within every little part. Refusing to allow negativity to win, I am moving forward, a new chapter to begin. So, yeah, just, I'm just in this place where I'm just allowing myself to feel the emotions, getting the help when I need to, and not utilizing the distractions anymore. And yeah, being that advocate for myself and continuing to heal out loud and share my journey with other people. It's one of the reasons why I was so excited to be on here and tonight just to share this new part of this journey that I've been on. You know, it's been it's been intense, but facing the emotions, being your own advocate, getting help is so worth it. That's what I've learned anyway.
No, you're right. And I appreciate you coming back on. And of course, you're going to be back on by the EOY, just so you know. Um, and, you know, uh, the message of hope, message of recovery, I think it's simple. I think it's really simple. You know, it's not running from those demons and running from that stuff that goes on through here and running from our, what we feel. I think it's really, taking the bull by the horns, as in like getting on going to a rodeo and doing and doing what we need to do as far as jumping on that bull, grabbing the horns, and literally just allowing ourselves to have a human experience. Um, Fear, anger, sadness, loneliness, anxiety, um, depression, guilt, content or content, contempt. I keep saying content as far as it relates to content creator, but contempt, disgust, uh, everything is natural and human, and it's part of just being, part of the human species, right? If you take off, every label that we put on ourselves, black, white, female, male, LGBTQ, criminal, non-criminal, rich, poor, uh, bisexual, lesbian, gay, whatever, um, tall, short, skinny, fat, or obese, or whatever the new word term is for that. We're left with the identity and the essence of being a human being, nothing more or less. And I guarantee you, I want to ask you, I want you to challenge yourself and ask yourself this. And do you not have thoughts and feelings? And does the people around you not have thoughts and feelings? And does the people that you work with not have thoughts and feelings? And don't they think differently than you? Don't they feel differently than you? Don't they perceive differently than you? And to all of those questions, you're going to say yes. Even I will say yes. And so, therefore, at the end of the day, we're all just a part of, we're all just a human being who has thoughts and feelings, nothing more or less. Right? We take the labels away. The government and the state can say, Kev, I want your license. And the school can say, I want your degree. And the other school can kick me out that I'm currently in. And you can take away everything I got. But a few things: one, you cannot take me away from my skin. You cannot take my thoughts and my feelings away. And you cannot take my relationship with this creator who is greater than I, right? Well, those are the four things you can't take from me. And that's just the bare minimum. The bare freaking minimum. I mean, I won't have any clothes, I'm sure nobody wants to see my birthday suit, but still, right? Like, just think about it, right? I won't have any labels. I won't have anything on me. I'll just be absolutely just a human being, just like you are. There's no difference between you and I. And once you factor in all these other labels, then you start bringing these differences between us. But you take all of those labels away, what do we have that separates us? And so that's where a lot of my clinical practice comes from. Comes from that ideal, from that bare, simple, main ideal there. And it's the truth. It's the absolute truth. And, regardless of whether research supports that theory or not, it's neither here nor there. I haven't read any research that yet supports this, but it's a fact. And a fact, to me, doesn't need to be researched, and it doesn't need to be well documented. It's just a fact, right? And that's how we live in, I think, what one of the spiritual books I read says, that's how we, love and tolerance is our code, and that's how we live in the essence of love and tolerance. So what? Somebody voted differently than me. Okay, it's their human right. So what? Somebody's black. So what? Somebody's got a drug charge. So what? Somebody used to be in prison. So what? Somebody OD'd. So what? Somebody attempted suicide. So what? A family is torn apart by what have you. Okay, somebody's got ALS or, Lou Gehrig's disease, I think is name for it. So what somebody's got borderline or bipolar.
EDS.
Yeah. No, right? I mean, doesn't matter. So what somebody wants to do, is do that thing that you were talking about that women do. I don't even know what it's called, but the thing you majigger where you do the inside stuff without I don't even know. I'm not women's health.
Oh, a hysterectomy.
Thank you. Thank you.
I'm like, I was confused there for a second, but okay.
Right. So what people want to get a hysterectomy? You're just throwing a label on a human experience.
Yeah.
Cool. Doesn't make
So,
you any different than me. I mean, only, I can't do a hysterectomy, but I can do whatever they call it to snap the tubes or snip or whatever, tie the tube. I don't know what the hell they call it. I don't know for guys. I don't know. I think it's vasectomy or whatever.
yeah.
I don't know. It is what it is. At the end of the day, we're all the same. You cut me and you cut you, guess what? It's going to be red blood that goes everywhere.
So, based on that concept of kind of just like letting go, right? Because that's what I heard, and all of that you said. It's just like let go of what other people are doing, let go of your own, biases, let go of your own traumas, and just try to be more present. That's what I heard. Is that kind of what you were talking about? So, based on that, I want to share one more poem before we go. And this one I think that you're going to love, and I think some of the listeners will love too. But it is a poem that I wrote by using song titles. And I think I have about 40 different song titles in this poem, but it's called Calming the Mind. And so it's that idea of just kind of letting things go and finding peace, right? And so I want to share this one. I think that you'll like it. So, Calming the Mind, a poem of song titles. If you can close your eyes and slow down, what will you find? Would the sound of silence be too much for your mind? Would you unravel or would you be undone? Would the landslide of memories be very fun? Would every breath you take bring you far away, or the pain of your past keep you lost in yesterday? Would hypotheticals cut your future seams ahead a boulevard of broken dreams? Or could you credit the past as growing pains and leave out all the rest until love remains? Can you allow for an unwritten future and stop asking yourself, what was I made for? Can you be present like nothing else matters until finally your castle of glass shatters, the one you use to protect your heart? Allow the revolution walking on sunshine to start. Imagine a life that's not radioactive. Don't stop believing God has peace to give. I'm a believer. You can get off the shelf. You can find an urge for going and find love for yourself. Be just the way you are, yet always strive for more. And no matter what, keep knocking on heaven's door.
I love it. I love it.
I had so much fun doing that. But I just wanted to, just finish up by just saying, with everything that we've been talking about, with all of the help that I've been able to receive, with all of these lessons that we've been talking about and lessons that I've learned, the basic fundamentals come down to allowing myself to feel my emotions, allowing myself to start healing from the pains of my past, from the schemas, from the trauma, from the actions of other people, the moral injury. Allow myself to just feel sad about them. Allow myself to feel angry about them. Allow myself to feel frustrated. Allow myself to heal from them and stop going into trauma cycles, stop ruminating, stop beating myself up, and stop taking things out on other people. Like that is the whole basis of all of this is learning how to allow people their autonomy for their actions. If they suffer for their actions or not, that has nothing to do with me. right? If they are still, if the people that hurt me are still pieces of crap, you know, if they have healed and they're doing great things, if you know, people that I love aren't trying to hurt me and they're just traumatized themselves and having trauma reactions, no matter what, if I can find that inner peace with myself and with my higher power, you know, I choose to call God, I've got God in Christ, you know, and if I can trust my higher power and just say, "I am going to take care of my actions and my reactions," allow God inside to heal me, allow the therapist to give me tools. If I can do all of this stuff, then it doesn't matter about the other people. You know, I don't have to hold on to the resentments. I don't have to treat other people and react to other people. You know, I can find my own peace. And that is with all of the work that I have been doing, and especially this last time in the facility, is just learning how to take responsibility for my actions, for my reactions, and stop reeling in those trauma cycles. And so that's what I'm working on, and that's what I'll keep doing. And you know, in recovery advocacy, this is how I help other people too, is by sharing my journey and encouraging them the same thing. I don't have to be a victim to my circumstances. I don't have to be a victim to my past. I don't have to be a victim to my emotions. I have choices today. I have the freedom of choice. And that's because I let go of the trauma cycles and I have let go of the addictions. And by letting go of the addictions, it freed me to a new way of living. And I will keep going and I will keep fighting and I will keep finding people who align with my values and keep walking away from people who don't, because I get to choose who I have in my circle today. And I don't have to let my past rule me.
Wow, that was absolutely beautiful. And this is just a general reminder for anybody, if you're watching or listening, doesn't matter. I'm exactly what she said, and also remember that at least your damn chart won't relapse. Yeah, that makes me mad every time I hear it too. I know that'll be okay. It's my job to challenge the current healthcare system and the status quo of it, and to flip tables. The reason I say that is because I got a good friend of mine who works in Missouri, and she literally challenges the system and where she works at because she has so many people who will OD, who will medical code. Okay, no heartbeat, no nothing. They don't go to a hospital. They go straight to their office to receive Narcan and be brought back. And they will, of course, the agency will tell them, you need to go to a hospital. We're not a hospital. And they will look at her and her team and say, absolutely not. I am treated as I am useless and worthless at a local hospital. And that's the type of healthcare system that we have. So until we fix our healthcare dilemma, you will continue to hear me say that your damn chart won't relapse. Now, with that being said, how can people contact you?
Oh, how can people contact? I was so confused. Okay. Yeah. So if you guys are interested in if you want to take a look at my own podcast, if you're a veteran or a veteran advocate and would like to be a guest, if you would like to access my poetry, if you would like to check out my photography, if you want to just send me an email with questions or concerns, or if you're looking for recovery advocacy, you know, local or not, I do video chats with people or phone calls with people all over the country. If you just need someone to talk to, you know, feel free to reach out to me, sliderbabe.com. So SLIDERBABE.com. You can access all of my socials on there. There's a link tree and everything. And so feel free to take a look and follow and reach out. My book is on Amazon right now, but it's only the black and white version. I'm still working with them to get the colored version, and I will be working on getting it onto my website so you can get a signed copy. So you can go to Amazon and check out the book. It's More Me Than I Used to Be, A Journey to Freedom. And so there is that. But like I said, I'm working to get it on my website. And once it's on my website, then you can get a signed copy. So wait on that, but keep an eye out on my socials for the update on that. So again, sliderbabe.com. All of my socials are sliderbabe, SLIDERBABE. And I also have a Facebook community if you guys are interested called Slider Babe. And if you look at it, it is all about encouraging people to creatively heal out loud through community. So if you join the community, you can go on there and share how you are using creativity in your life to help you heal and to share your healing with other people. You know, we have one guy who restores old cars to make them look older. It's very interesting. You know, there's people that do AI song creating. There's people who are doing art and painting. You know, I've got my poetry, so, you know, whatever you are doing, a lot of podcasters, you know, whatever you are doing to move forward in creativity, we would love to hear about it. So again, Slider Babe or sliderbabe.com.
I love it.
Thank you so much for having me on here. This has been so much fun, Kevin.
Hey, listen, you're more than welcome any time of the day or night. Don't matter to me. Right.
Yeah.
Anything else that you need people to know, or you would like for people to know? Anything else?
Um, the only thing that I'll say is again, just remember you don't have to be a victim. Being a victim and suffering is a choice. You know, we have the ability to reach out for help. There's so many different programs out there available, and I would just encourage you to reach out for help. Get the help that you need, whatever it looks like, and just keep moving forward and don't give up. One step at a time. You know, whatever you need to do. So I have to tell my brain consistently to shut the hell up, and I make a choice, you know, like my choices are between me and God, and it has nothing to do with my brain sometimes. Like because my brain is sick. It's just I between the addictions, the borderline, you know, and anxiety and depression and stuff like that, my brain is not on my side most of the time. And so I have to allow my spirit to make my choices for me and to get the help that I need sometimes. So I just encourage you guys to do the same.
Folks, you heard it best. Miss Marie, she brought the message of hope, brought the message of recovery, shared with everybody, and we bashed the current healthcare system because she's right. We, again, flipping tables, making change, and creating chaos. Of course, we've got to say that one, especially, in today's society, anyway. So, folks, listen. All jokes aside, we like to come on here, have fun, shoot the crap, as they say, and have some lot of good laughs. We have some tears too here and there. If you're struggling, reach out. Reach out. Many people are willing and able to help. So, and check us out too while you're reaching out for help. We're also a resource for you. We're on 45 different platforms. I think the last time I counted, we're across the board on I mean, just across the board on almost all social media now. I mean, everything from Apple. Um, Now we're in some country in Africa as far as their main on podcast thing over there, something similar to Apple, but it's native to Africa. Uh
Awesome.
yeah, right. It was another program I think that we got put on in the Middle East, I think, if I remember correctly. So many platforms. We're on Facebook, Instagram, X, LinkedIn, TikTok. Spotify, YouTube. I mean, there's just so many, so many. So follow us. It's free. You don't have to subscribe to it. We let all our stuff free. We make no money on what we do. The only thing that is monetized, I think, is my personal Facebook page. Um, and I share everything up there, of course. But um, so yeah, it's free. Just check us out and check Miss Marie out. Follow her on Instagram, Facebook, social media. She's on TikTok too, I think. She's across the board, similar to us. So
YouTube.
yeah,
Yep.
YouTube, yeah. And buy a book from her. Buy a book from her. We get no money from her book. We don't ask her for any money. Buy her books. Subscribe to her channels. All of them, whatever platforms you're on.
If you are interested, so obviously I'm selling my book, but I don't plan on making a ton of money with it, I'm just doing yeah. Anyways, but with that book, my goal, if you are interested in a nonprofit partnership regarding the book, my goal is to get the book into recovery centers, trauma centers, and hospitals and jails. So if you are interested in donating books for that cost, I will charge you for the cost of the printing and the cost of the shipping, and that's it. So it'll be a little bit cheaper, and you will get a free book as well, a free signed copy of the book. I already had somebody who bought 10 from me in North Carolina, which was really awesome. Yeah, in Charlotte is a friend of mine who decided to buy 10 books, and I sent her an 11th one free, and she is giving them out to some of the ladies in some of the recovery centers down there. So, if you are interested in doing that, I would love to partner up with you. I'm actually working on trying to get some grants to get some bought and put into some of the local facilities. So, if you're interested, please let me know. Again, you will be charged just cost and shipping. If no, won't even be shipping because I will be donating them here. But if you have a special location, then it will be if you wanna donate for okay, sorry, my brain. If you wanna donate for here in Utah, you won't be charged shipping. If you want to donate where you're at, it will be the cost of print and the cost of shipping, and that's it, and then you'll get a free book. So, let me know if you're interested, I would love to partner up with you.
I love it. That being
Yeah.
said, folks, we have to end our live show and then let everything upload. So reach out if you want to be a guest on our show. Reach out if you want to just buy a book and support her. Reach out. Uh, and if you want to subscribe to my personal Facebook, go to our link tree, which you can find on YouTube. And I think most of our other social media sites. Anyways, we have to end a live. Oh, I can keep her up here for like another 2-3 hours and BS with her, but I want to save some fun for later on. Oh man, Miss Marie, peace and love.
Alright, thank you. Thanks for having me. Bye, guys.